think the importance of local community, perhaps married to and as a filter for helping to discern the truth from the misinformation on the technology platforms, is going to be an important part of this response.
Steve, Brad, and then we'll go down the table here.
Just 2 points. First is that we have to recognize that we are all susceptible to misinformation based on our prior beliefs and experience. And I think with the social media platforms, there's an opportunity to understand who it is that's susceptible in what form to misinformation. So I think there's an opportunity to collect data from that communication mechanism. The second thing is, with that ability, we can identify false information more quickly. We are actually receiving reports about people trying treatments that are purported to be effective but are actually harmful. And the quicker that's recognized and can be countered, the fewer people will fall susceptible to those things.
Okay, thanks, Brad.
Yeah, I don't want to be repetitive. I agree with almost everything that was said, but when we talk about our health, who do we typically trust? Our physician. And we're not talking about that right now. So, I mean, we need the physicians and the medical community really out there on the forefront talking about this. I remember I had access to local news in Atlanta when the patient was taken care of for Ebola that came back, and physicians were on there nightly talking about, you know, don't panic, it's okay, this isn't going to go spread. So I would add physicians to it.
Okay. Yeah.
Some important news to share from our member companies. Rumors are actually spreading that the antivirals are causing gaps, and so patients are not taking them anymore. And this is particularly an area where we have government mistrust. On the other hand, it's interesting because we are doing clinical trials in new antiretrovirals, and in fact in vaccines, and social media, including Facebook, is actually enhancing recruitment. People are going to it, and they're actually seeking information on where they can participate and sign up. And so I sort of wonder that maybe we're in the mistake of reporting and counting all the fatalities and infections, and we're not sharing with people what are the wins. You know, who are the patient advocates that can say what worked for me, and maybe you should try that. I think we have an opportunity here.
Okay, George, and then Avril.
Oh, sorry, you go ahead.
No.
You know, by now, you know, we have more cases in China and also death cases reported, and also my staff told me that because there's misinformation and there's some belief, people believe, you know, this is a man-made, some pharmaceutical company made the virus. So there are some violations and even, you know, deaths because of this misinformation. As a, you know, from like the CDC, and I don't know whether Steve agree with me, when you are doing the field work and you like to do some so-called TOT, training of trainers. So we really need to train the health workers, especially health care workers, their access to the patients, to the public. So make sure they got the right information. So not necessarily, you know, sometimes the health care workers, they know something, but if they are not well trained, they might give the wrong information, but also they might say something, oh, I don't know. You know, even I don't know, that could hurt. So when I remember that's such a situation reminded me. When I was in Sierra Leone, and I was interviewed by radio, the national radio, I was asked by one of the audience to say, okay, we believe Ebola was man-made. It's transported from, you know, somewhere. So this is, I think this is very important. We do the TOT. So make sure the healthcare workers have the right information.
Okay, thank you. Avril?
I very much agree with that. So, I mean, I think I agree with a lot of what's been said. I'd just add to it maybe by saying that I think one of the things we want to do is work with telecommunication companies to actually ensure that everybody has access to the kind of communications that we're interested in providing, because that's going to be critical for dealing with, you know, obviously the explosion of the disease. And then another issue, I suppose, is just through that, if you have a trusted source, I believe in the idea that we shouldn't be trying to control communication, but rather flood the zone, in a sense, with a trusted source that then is influential community leaders as well as health workers, as Brad noted, and others, on these issues in order to try to amplify the message that's coming through. And I think Tim's absolutely right. I certainly seen the value of communicating constantly on these issues so as to continue to deal with, sort of the vacuum that can be created in this circumstance. But then also with the comments made about the fact that for all of the disinformation that will be put out, it's going to be important to actually have a response to those questions and to those concerns, as Stephen said. And I understand from staff that actually there are also intelligence sources identifying multiple foreign disinformation campaigns and so on. But it's all a part of a larger piece, which is to say that every time there is something that comes out that is in fact false information that is starting to actually hamper our ability to address the pandemic, then we need to be able to respond quickly to it.
So I have a number of comments here. People want to react to what Avril just said. I see a couple of fingers just went up. Matt and Tim.
I think just to build a little bit on what Avril said is I think as in previous conversations where we've talked about centralization around management of information or public health needs, there needs to be a centralized response around the communications approach that then is cascaded to informed advocates, represented in the NGO communities, the medical professionals, et cetera.
You mean centralized internationally?
Centralized on an international basis, because I think there needs to be a central repository of data, facts, and key messages.
Tim, you wanted to comment on that, and then we'll go back to regular order here.
Yeah, I think one important thing is there needs to be a sense of two-way communication, which is people on the front lines may be finding out that actually the system's not working as it should. And I think there should be a culture in the communications to feed back to authorities, places where the system is broken down, where supplies are short, where there are no health workers, where hospitals are dysfunctional, et cetera. Because that, and then with some credible investigation process, which is that then values the client. The second dimension of it, I think that's really important, is to get individual narratives on this. I mean, the fact is that most people will survive. And that's probably not a widespread public perception. And so people who have lived and survived and can say that they got good care or that they were treated appropriately will help build confidence in the system in a way that perhaps the data doesn't do as effectively.
Hasti, Latoya, Sophia, and then Jane.
So I think a couple of things we have to consider are, even before this began, the anti-vaccine movement was very strong. And this is something specifically through social media that has spread. So as we do the research to come up with the right vaccines to help prevent the continuation of this, how do we get the right information out there? How do we communicate the right information to ensure that the public has trust in these vaccines that we're creating? And secondly, news organizations in some countries are right now under a lot of pressure from their governments to provide politically favorable news. And so we have to think about, this isn't just the United States where we sometimes take the freedom of press for granted. There are countries where the news organizations are owned by the government, and how are they disseminating information, and what do we need to be thinking about? How do we communicate with those governments to ensure that misinformation and disinformation is not being spread?
Thanks, Latoya.
That goes along with her. I've received information from my staff saying they're confused about the different authoritarian public health messages that are coming out from all the different sectors, the countries, the states, and different cities. And they're concerned about the differences, what the World Health Organization is, saying versus what their government is saying and what the total consensus are. So with that being said, looking at hotels from that perspective, we're in a bind in knowing how to proceed.
I see. Sophia?
Thank you. The discussion is focusing on mis and disinformation, but I think what's important to counter some of that is to actually put out information or good news stories of people who have actually beat the disease, or best practices in other parts of the world that is delivering on results and sharing that. But also I agree on the point on having a centralized source of information and a world body that could have garner the respect of everyone, and I think the WHO in this instance might be that source of information. And again, using the UN networks on the ground in many of these countries has a UN presence through its resident coordinator systems and I think based on the Edelman Trust Barometer, the UN still enjoys a lot of trust around the world. So it's a good bet. Thank you.
Thanks, Jane.
So I just want to
Come back.
focus, if I could, for a second, on why we communicate, what the purpose of this communication is. So there seem to be several elements to this conversation, one of which is to get the facts, however you define them, out there. But let's be completely clear. We have known for many years that tobacco kills you if you consume it. It's a fact. And it's a crapshoot whether you're going to be in the 50% proportion who's going to die very young, but we know this as a fact. There are some things we know that are widely held. Doesn't mean it always changes people's behaviour. So I think we should also focus in a conversation about communication, about what the purpose of that communication is, and think about what we know about incentivising the kind of behaviours we want to see. I agree with Tim completely. It needs to be two-way. So governments and people who are organising service delivery, businesses who are trying to operate in this environment, they can do that optimally. But we should also think in a communication sense, it's not just about handing people a piece of knowledge. It's also about how we incentivise them to manage their behaviours, which in any communicable disease outbreak, behaviour of one sort will minimise your chance of getting a disease versus behaviour of another sort, which may maximise that chance.
Thanks. Chris?
Yeah, I just want to come back to the community. Judging from the statistics, we currently have 4 million survivors. We may in a month have 11 million survivors. Assuming this is like other respiratory pathogens, they're now immune. And they live in the communities, almost by definition, that are affected. So can we turn the survivors into an effective community-based source of accurate information? They're going to be the least likely to be wanting to spread false information. They're going to be motivated by having survived this outbreak and knowing loved ones who are also affected. I think they could become a very effective force for intervention at the community level.
Thanks. I'm going to turn to Levon. I just want to ask one other question to think about as Levon's commenting. We've talked a lot about misinformation and flooding good information. We've just started to talk a bit about disinformation and the strategy around that. And Avril or others, after Levon comments, if you have any additional thoughts about the particular approaches to disinformation that may be distinguished from misinformation, it'd be good to hear about those.
Yeah.
But Levon?
So I've received a note to say that some bad actors are actually using social media to spread rumors about specific companies in order to profit from short selling. So, along the lines of what we've been talking about, this is going to cause companies to come up now to get some of the screen time as well, because they need to spread the correct information. But one thing we haven't spoken about, and I'm wondering whether it's time to talk about this, is a step up from the part of the governments on enforcement actions against fake news, right? Some of us, these are new regulations that come in place about how we deal with fake news. And maybe this is a time for us to showcase some cases where we are able to bring forward some bad actors and leave it before the courts to decide whether they have actually spread some fake news.
So we have about 3 minutes left for this discussion. I just want to throw one more question out for your final thoughts on what if it is, as some people have raised, governments that are spreading misinformation either inadvertently or to some political advantage. How do we work around that with international organizations or business? Are there particular things that people haven't mentioned already that are worth talking about? But does anyone want to talk about either that or disinformation or other topics in the last couple of minutes?
Sure.
Sorry, go ahead.
No, please.
So kind of a very quick so I want to touch a little bit about science. I want to follow Chris' talk, because that's a very good challenge. We have survivors. Because we have so many survivors, the epidemic already for 2 months. We have all these modern technologies and the platforms. It's time to think about it, to try to isolate the human antibodies for this, because this is the very serious pandemic, but we want also to see the future. That will help science-based information. Thanks.
Thanks. Avril?
Sure. If you have state-sponsored disinformation, there's obviously additional tools that you can bring to bear to try to address that situation, not the least of which is bringing together other countries to effectively, take action against them for the kind of campaigns that they're propagating. But but generally, I would say the disinformation, the line between disinformation and misinformation is not always an easy one to find. And the reality is the greatest, way to impact it, in my experience, is not to let it sit. So in other words, find your trusted interlocutors that are capable of saying, this is not acceptable, this is in fact the truth, here's the information. And I think the community of survivors is one example, but there's a whole series, employers, trusted faith leaders, variety of health workers, and so on can be part of that. In addition, obviously, you want to work with the private sector and